Chronic pain sufferers are always asking me about my opinion on TENS units, so here you go. TENS stands for transcutaneous, so meaning through your skin, electrical nerve stimulation. What we're essentially trying to do is influence your sensory nerves with artificial electrical stimulation. But before we fully understand that, we have to understand that there are three different types of nerve fibers. First being A beta, responds to things like touch, pressure, vibration, and joint movement. The second, A delta, sharp local pains. And then C fibers, dull, achy, burning, and throbbing pains. Now, what makes these fibers different is their diameter, but also the level of myelin that is insulating those nerves. If you remember from a few videos ago, myelin is the insulation that makes nerves fire more efficiently, and it's mainly composed of fat, so that's why we love the right types of fat for chronic pain. A beta fibers have the largest diameter, but also the most amount of myelin, therefore they fire the fastest. Then A delta fibers, medium amount of myelin, medium density fiber. And then C fibers, lowest diameter and no myelination. So they fire the slowest. Now, if you're putting this together already, vibration, that's what TENS unit is doing. Dull, achy, burning, throbbing pain, typically more characteristic of chronic pain. So if we go back to our gate control theory of pain, by stimulating these A beta fibers, we can create more descending inhibition before the C fibers can get to the brain, and therefore they get cut off, and that's why you feel less pain when you're using your TENS unit. But the level of gate control that the TENS unit is producing is minimal, and it typically only lasts as long as the treatment or maybe a little bit further. So TENS units feel wonderful for pain, but it's definitely not fixing any of the causes of your pain. It's basically just a safer ibuprofen